It is 1835 in Charlestown, Massachusetts, and living in this bustling neighborhood is Bill. Bill is a relatively healthy 23-year-old fisherman who is well liked by his community for his boisterous personality and immaculate sense of humor. Thus, on an unsuspecting Saturday outing with his neighbors, when Bill, who always has the biggest presence in the room, was unusually quiet, and the tall 6-foot man with the normally voracious appetite was not devouring his favorite roast chicken, his friends realized that something was off. Bill himself shook it off as a minor sickness that would soon pass. Poor Bill, however, suffered multiple feverish nights and soon decided to go pay a visit to the popular local physician, Dr. Jones. After some poking and prodding, Dr. Jones was quick to diagnose Bill with pneumonia. He told Bill to wait in the room while he went to prepare for Bill's treatment. Bill maintained relatively calm because he knew he was in good hands. After all, he was at Charleston's finest. His cool facade, however, quickly crumbled when Dr. Jones entered back in the room, carrying with him a bucket of, can you guess? Leeches! I'll save you the gory details, but basically poor Bill had around a pint of his blood sucked out of him by these slimy little creatures to treat his illness. Did he feel better? Eventually, but whether the leeches were the cause of his recovery remains up to debate. This scary treatment method has a name: bloodletting. Bloodletting was actually a common practice used to treat bacterial infections like pneumonia before the invention of antibiotics. It originated in Egypt in 1000 BCE and was practiced all the way up until the mid-20th century. Bloodletting was rooted in an ancient medical theory that argued our health was reliant on the balance of 4 bodily fluids: blood, phlegm, black bile, and yellow bile. An imbalance would manifest as illness, and in the case with infections, people believed it was caused by excess blood flowing in our bodies. Therefore, treatments like bloodletting, where the body was purged of fluids, were common. Unsurprisingly, many patients oftentimes ended up being more sick than before, as these practices were unsafe, unsanitary, and misdirected. In the case of pneumonia, for instance, it is bacteria that causes sickness, not excess blood. Well, thankfully, today, if you have pneumonia, or any bacterial infection for that matter, your friendly neighborhood doctor will prescribe you a small white pill, antibiotics. Within a couple of days, your sickness will be gone. How easy and simple. The discovery of antibiotics was truly revolutionary for our species. Today, we view diarrhea and pneumonia as mild illnesses that can easily be treated with antibiotics. But even until the 19th century, these two conditions were the leading causes of death in developed nations. In fact, Sir William Osler, who is considered by many to be the father of modern medicine, described pneumonia in the late 1800s as the most fatal of all acute diseases. Back then, even small cuts and wounds could have had serious health consequences, ones that we cannot imagine, thanks to antibiotics. After they were first discovered by Alexander Fleming in 1928, antibiotics were made available to the public in the late 1930s, and almost immediately, from 1944 to 1972, human life expectancy rose by 8 years, and the survival rate for pneumonia rose from 20% in 1937 to 85% in 1964. The human race jumped over a huge medical hurdle with this magical white pill. But in recent decades, misuse and overuse of antibiotics has created a new threat called antibiotic resistance, where bacteria have stopped responding to antibiotic treatments, making them useless. If antibiotics do not work anymore, is there a possibility for us to go back to bloodletting practices? Check out the following 2 videos to find out.